So this is a National Cancer Institute-led study on hospitalized cancer patients with COVID-19. This was a nationwide study that's actually still ongoing, and this is the initial report from that trial. Our hope was to enroll a cohort of patients prospectively that had active cancer, by which we mean, patients were receiving treatment for either a hematologic malignancy or for a solid tumor. And their data regarding hospitalization, outcomes from hospitalization, and details about the patients themselves was included in this study. Not published here, but we're also collecting biospecimens for future correlative analyses as well. So in terms of results, we found so far at the time of the abstract submission, we had enrolled about over 750 patients. We found that the most common cancers that led to COVID hospitalization were lung cancer, multiple myeloma, and lymphoma. And to us, this suggests that these three diagnoses lead patients to be more at risk for COVID-associated serious illness, serious enough to be admitted to the hospital. In addition, we found that about 22% of patients who were admitted ended up in the intensive care unit, but only 25% of those admitted to the unit received invasive mechanical ventilation. So this suggests that there's a high rate of ICU admission, but not all of the patients who are admitted to the ICU receive invasive ventilation. Whether these decisions were made because of the patient's underlying cancer, or whether there were other factors associated with that decision, we don't fully understand. And then finally, we found that mortality was high. It was 16% of these hospitalizations, unfortunately, resulted in the death of the patient. So I think our conclusions are that COVID-associated hospitalizations are more common in people with myeloma, lymphoma, and lung cancer. And so oncologists should be wary about COVID in that population, and should also be aware of the very high rate of mortality once these patients with active cancer are hospitalized.